Conservative.
Christian. Mother. Wife.
Air Force veteran.
Gun rights advocate.
This is Stacy on the Right. Here's your host, Stacy Washington.
Live and direct to you on a Friday evening, and we're so grateful for your time. Find out more at stacyontheright.com. Welcoming into the show, Andrea Hitt, Communications Director or Manager at the Texas Public Policy Foundation, former Communications Director for Congresswoman Debbie Lesko, Republican from Arizona, and she's a contributor to Young Voices at _Hitt_ on X. Thank you so much for coming on.
Thank you so much for having me. It's an honor to be on.
I'm glad you're here because, whoa, you have some great information you're bringing to us tonight. So let's start off. You are talking about this. It's a serious issue. Americans sometimes have trouble accessing health care. And when they're trying to get that done, and they're doing so outside of an employer-based plan, it can become not just cumbersome, but almost impossible to navigate the healthcare system. And so the answer to that by many is to say, well, we should give it to the government. We should have the government take it over. And if we do that, the government will make everything right. And you're writing about this and you're writing about Medicaid. So tell us where you fall in the spectrum and what solutions you're proposing.
Absolutely. So I'm here in Texas, and Texas is one of the few Republican states that have been holdouts to Medicaid expansion. It's been in the headlines a lot. Mississippi, another red state, is looking to expand Medicaid. North Carolina, another red state, expanded Medicaid last year. But the problem we are seeing is that Medicaid is designed to fail. It is a broken system, and we shouldn't be overburdening a system that is already not working for the people currently on it. And here out in West Texas, it takes about 100 miles to get to the nearest hospital. And a lot of people in rural communities rely on Medicare or Obamacare for their health care. But when you live that far away from a hospital, it doesn't matter whether or not you have a plastic insurance card. That is not going to help you in the event of an emergency if you cannot access the care that you need, the emergency care you need, in a timely manner.
So what is the answer to that? Because I see in cities we're providing relief to our hospitals and emergency rooms by setting up numerous urgent cares. And at first they were run by private entities, but now hospitals have caught on and they're setting up urgent cares under their own brands, where the same hospital that you go to see your doctor, or it has the emergency room that you would go to if something happens to you, also has urgent cares placed strategically all around the suburbs and the city, so that you don't actually have to come into the hospital. You can go to the urgent care and have, your cold or your flu, or, maybe you have a cut on your hand and you need stitches. That kind of stuff can be handled there. And they can also do testing.
Absolutely. So when you especially look at rural America, and I'm going to use rural Texas again as an example, one of the problems we're seeing is, you're absolutely right, Medicaid patients, unfortunately, tend to seek out emergency room services first before seeking out a primary care provider. The problem becomes there are 32 counties with not a single primary care physician, and there are even about half of the counties in Texas don't even have an OBGYN or another women's health provider. So you're not even seeing those medical professionals who can give you more of that primary care, that urgent care. So you're left with an emergency room, which is far more costly. And if more and more people are going to these emergency rooms, that's going to add increased wait time at those ERs when people are in critical situations. Another problem that goes along with that is financially, a lot of doctors don't want to take Medicaid patients and other people on these government-run healthcare programs because they reimburse so little. So when hospitals and other doctors take on these patients, they are incurring a huge financial loss on these patients. If enough of their patients are on these programs, they're going to operate at enough of a loss that they might shut down, which will, if there are fewer hospitals, fewer providers, that's going to exacerbate the distance that you're going to have to go to if you need to seek care. And that's one of the things that we are looking into here at TPPF is we want to make sure that, we want people to have access to the health care that they need when they need it. And we want to make sure that they have access to this quality care. But physical presence of care is one of the things that the left is missing when talking about Medicaid expansion, when talking about Obamacare expansion. Just because you have that plastic insurance card does not mean that you are guaranteed good care.
Yeah, and then with Obamacare, people think they're actually on like a thing that's called Obamacare. It's not really. Obamacare is just a plan that is offered within the Affordable Care Act exchange, but it's offered by the same healthcare provider that you might have had before. Let's say you have Aetna, and you had Aetna through your employer-based plan. You lose your job. You go out into the ACA marketplace, and you can find an Aetna plan that is not as good as the one you had with your employer, but is, bare bones but similar to what you had. And so you'll be on the Aetna plan, but it's in the marketplace, so it just has a little designator on the plan when doctors look at it, when hospitals look at it, when you're making an appointment, that delineates to them that it's Obamacare, that it's the ACA, but it's still provided to you through Aetna. So the card that you have, that you're using, says Aetna. It doesn't say Obamacare. So I think there's people who don't use it, who've never had an experience with it, don't really understand that, but that is the reality of what you're doing when you have the ACA. You're still using private insurance. It's just paid for by the taxpayers, and it's the rates and everything are different, and your access level is different.
So that's absolutely correct. I think that is one of the things that people also forget about is who is covering these costs when you have, again, specifically going back to Medicaid, that is paid for by the taxpayers. So if you're expanding Medicaid, you're going to see an increase in taxes unless those states make cuts to their budget elsewhere. And some of that is provided by the states, some of that's provided by the federal government. The percentage of that varies on the state, but someone has to pick up those costs. So it's not this great free expanded program that people think it is. And then again, going back to the hospitals, and they incur losses on these Medicaid patients because they are reimbursed at such a lower rate. Well, they have to make up those costs somewhere else, and they're going to pass that on in what they charge for each procedure. And, that's not going to be passed on to the insurance companies. Those insurance companies are going to pass it on to other insurers and other patients, whether or not they have insurance. So Americans are going to see increased costs at every single level in their taxes and in their healthcare services. And that is not the kind of healthcare system that we want to see. We believe Americans deserve better, and we are working to reduce those healthcare costs.
So I would like to see exactly what you're discussing happen, but I feel like the people who are doing the work on healthcare are not as prone to, or maybe not able to. I'm not sure what the limitations are, what's actually stopping them. But we can get a bill through on banning TikTok, but we can't seem to get a bill through that has anything to do with healthcare. Like we just can't seem to get it done.
Well, I think there's a lot of things that play with that for sure. I think a lot of it comes down to, people don't want to. I think a lot of politicians are afraid to go up against these big insurance companies, and even some of the hospitals that we've found through some of our research are overcharging. They're not being as transparent about their prices. Congress has passed price transparency rules. Here in Texas, we have price transparency rules, but there hasn't been a great enforcement mechanism for that. And I think people are, a lot of people on the right are afraid to tackle this issue because, of course we want to give people health care coverage. Who wouldn't want to do that? But again, they forget the reality that expanding coverage does not equal expanding access to care. It sounds like a nice Band-Aid, one-size-fits-all solution, but that's never the case, and that's never going to be the answer.
Well, I think if there is an answer, we want to see it, we want to hear it, we want to know what it is, and we want Americans to have access to the answers, and then an ability to choose. I'm interested in the choice that people could have. I don't see that if the government takes over more of it, because Medicaid patients and Medicare patients, what they don't have is a lot of choice.
That's absolutely correct. We need to be using the market to create more choice. And one of those reasons that I propose is physician licensing reform to bring in more doctors. And the more doctors we have, the more facilities people have setting up when doctors come in and set up their own private practices, the more doctors that aren't overburdened in these ER rooms, or these doctors that aren't, the only doctor in that county. That'll bring in more choice. People will have more options for the facilities they want to go to, and that'll lower prices naturally. And when you have more facilities as well, people don't have to drive those 100 miles to the nearest emergency room, and that will result in better health outcomes for patients. We really do need to utilize the market, and the government, unfortunately, creates a giant monopoly with very perverse incentives to get care. And that's not what the American people deserve. That's not what people in rural Texas deserve. And we want to create a better healthcare system that does work for them and does give them better options and lower costs.
All right. So what I would love to do is talk a little bit about some solutions that have to do with, like how can people the solutions that we want, right? How do Americans get the solutions that they want from elected officials? Is it phone calls? What is it? How do we get it done?
Well, we certainly recommend calling your representative and just making your voice known. If people aren't hearing from their constituents, then they can't gauge what their constituents really want. They're not going to vote in the best interest of their constituents. We certainly recommend calling, and that will at least bring the issue to the attention of the lawmakers for sure.
So I think,
go
ahead, please.
Oh, no, I would also, propose, when your elected official comes and hosts a town hall or a similar event like that, going and, asking those questions and, meeting with them just to make your voice heard.
All right. So I want people to also know where to find more resources. And I know at your organization, you're constantly writing and researching and bringing information to the fore. Tell everyone how to find out where your writing is and what they can learn about the solutions that you're proposing.
Absolutely. Well, if you go to texaspolicy.com, and we have our Right on Healthcare and Center on Health and Families initiatives that are really focused on bringing these common sense healthcare solutions and that are really focused on lowering costs and delivering better, because that is our fundamental goal, is specifically here in Texas, bringing lower healthcare costs and better healthcare outcomes and better healthcare access to Texans.
I love it. All right. Thank you so much. We appreciate your time. And I know it's difficult because what we're looking at and all of these things is you have the policy, but then you have how things are impacting people. And people are bound to, look at things and apply them to their own situation. And there are 340 million people. That means there's 340 million different situations. And we're trying to find solutions that will fit, the majority of people and hopefully have an impact for them. Andrea Hitt, thank you so much for joining us from Texas Public Policy Foundation. Good to have you here.
Thank you so much for having me. Have a great rest of your day. It's been an honor.
Thank you. You too. And we'll be back with more after this.